Welcome to the Partner Related Brain Injury Task Force. Happy to have you all here. And hopefully everyone will be in Montreal next month, and we will be having our meeting in person on that first Wednesday of the conference. Before I pass it over to Rachel, Angela, do you have any updates that you'd like to give the group?
Oh, just to thank you for your leadership with the IBIA conference, the pre-conference, and then you're also ending with the last talk on sex and gender concerns. So great work.
If you're in Montreal, let us know. And if you have a talk that you'd like us to put on the email, that would be great. All right, Kate and Eve sent their regards to the group. I'll pass it over to Rachel.
Good afternoon, everybody. Thank you so much for joining us. My name is Rachel Ramirez. I use she, her pronouns. I'm from the Ohio Domestic Violence Network, which is a statewide coalition in Ohio on domestic violence. We have 76 member programs here, and I have been at ODVN for it'll be 18 years in April. I'm really excited to have the opportunity to talk to. I have several special guests who are joining me today who have been partners, colleagues, friends, and cheerleaders in this work that we've been doing in Ohio. And just
let me interrupt 1 second. Thank you, Rachel, for putting the invitation to this out in your email list. If you joined from Rachel's list, if you joined because someone passed it along, we have this meeting for the last Tuesday of the month, most months of the year. If you want to continue meeting with us, you need to sign up for our email list. I send an email about a week before the meeting and the day before the meeting, so I'll put that in the chat. So if you just came for this meeting, we'd love if you stuck around for other meetings. And thank you, Rachel, for promoting it on your channels.
Yes. So I have lots of special guests here. And what we're doing is we're just going to really have just kind of a conversation about the brain injury work that we have been doing here in Ohio. I also want to say, I know I see many names and many friends, new friends, old friends. I think at one point my mom and dad are joining us. So Mary and Steve, if you're on there, that's my mom and dad. So I say hi to mom and dad. They have obviously played a big role in who I am and what I do today. But just to get us started, I want to see if I could get some of my partners, my Ohio partners, and I'm just going to kind of call on you all one at a time. If you could just start by just introducing yourself, talk a little bit about what you do. What is your background in either brain injury or domestic violence or both? I just have a series of questions that we're going to have just some of our different people go through that. So I have 4 guests joining me. And if it's okay, if I'm going to get started with Kedar Hiremath. If you're okay, Kedar, if you could just take yourself off mute, just give us a little bit of background about who you are. And if you come from the brain injury world or the DV world or some other kind of world.
Sounds good. Thanks, Rachel. Hi, everybody. Nice to meet you all. I'm Kedar Hiremath. I am the Associate Director for Ohio State's Chronic Brain Injury Program, which is an interdisciplinary research center at the university. We are in the brain injury space. The title is Chronic Brain Injury. So we're really focused on not necessarily helmets or seatbelts, but we're really thinking about what happens to a person after they've had an injury and how that injury could persist or how that can affect their lives going forward. We are not focused on just biomedical. So we're really thinking about the life experience following brain injury. So maybe a little bit more specifically, my role is to lead research strategy and development, especially for early phase projects across campus that require more than one discipline. So we're really exclusively an interdisciplinary group, and also listen to those outside the university. So identify projects, needs, opportunities inside and outside of campus, put teams together to do the research. I also have roles at Nationwide Children's Hospital and our state advocacy organizations. And so it's really about doing the land grant mission for Ohio State, which is to serve the people. And I guess that's probably enough at this point.
Thank you very much, Kedar. And now I'm going to see if Dr. Julienne Long could introduce herself and talk a little bit about her background and what she does and what her experiences in DV and or brain injury.
I always love to follow Kedar. I'm Julienne, and I'm the advocacy coordinator at the Columbus City Prosecutor's Office in the Domestic Violence and Stalking Unit. So I'm coming to you from the justice system world. I was introduced to brain injury from violence a couple years ago as I was finishing up my doctorate, and now that I know about it, I can't stop thinking about it. We reviewed some police reports thinking like maybe we'll find some that involve brain injury from violence, and they're just most of them, whether that's multiple blows to the head and or strangulation. We were the last state to adopt strangulation as a felony, so we're behind everybody else, but we now view it as a felony, and we've been doing that for about a year now. Our police force and our county prosecutor's office is overwhelmed by the amount of strangulations that come through. And honestly, there's a lot of misinformation or no information about strangulation and how that impacts their survivor or just blows to the head in general, and how oftentimes during an assault, it's multiple blows to the head and or strangulation that's happening, not just once in a while or not just one time during the incident. So I'm happy to be here. I love working with Kedar and Rachel, and I feel really excited to be exposed to another organization that is working on this as passionately as I feel about it. So happy to be here.
Thank you, Julienne. And now I'm going to pass it on to my friend, Kehl.
Good afternoon. My name is Kehl, and I'm with the Ohio Department of Children and Youth. It is a relatively new state agency whereby we have combined kid offices from our department, some parts of our Department of Education, Department of Health, Department of Developmental Disabilities, the Department of Mental Health, and what was formerly the Department of Job and Family Services. My role is trauma-informed care. I do a lot of work with all of our licensed facilities, of which we have a little over 9,000, including early childhood all the way up through adolescent group homes. And I've worked on and off with Rachel for about 155 years. I've learned a lot from her and have come to respect her work. And when we think about this particular topic, it's not hard to make the connection between kids who wind up in out-of-home care, particularly, or who come into Child Protective Services, and some correlation. We don't do a very good job of collecting that information, so super excited to be a part of this project and how we take this in an increasing demanding job of child welfare, and how can we make it seem important for our county caseworkers to pay attention to this.
Thank you, Kim. We are going on about 156 years together. So it's great to many of these colleagues I've worked with long enough that none of us know when we started working together. We just kind of have always been doing this work. And I would like to introduce, last but definitely not least, my colleague and friend, Kasey Holderbaum, who works with me at ODVN and has been an integral part of this teamwork and this group work. Kasey, tell us a little bit about your background and kind of how you came to this topic.
Yeah, hi everyone. My name's Kasey. I use she, her pronouns, and I am the Health and Disability Project Coordinator. So I get to work with Rachel at the intersection of brain injury and domestic violence. Good to see some of y'all again. My background is in direct service, victim advocacy from Colorado and Texas here in the United States, and been back in Ohio doing this work at the systems level for about 2.5 years. So really excited to be part of this group and for my friends and colleagues to share about some of our initiatives here. So excited to be here today.
Perfect. Well, and so that's our group. And like I said, we have many more members of this group, but I think one of the things that has been so interesting and so fascinating as we move into talking about I think what we're trying to do today is tell us kind of just a little bit of the story about how we have people coming from all of these different places, including places like Kedar, a university multidisciplinary center that focuses on brain injury of I, of course, had never really heard of before I got started of this work. I don't know if I'm speaking for Kedar. He might not have really heard of ODVN and the Ohio Domestic Violence Network in our work. Julienne and I have worked together on some things, but not the brain injury stuff. And then I know one thing from, working with Kasey, who comes from a very, very long line of direct service work and has worked in just about every domestic violence job that you can imagine with survivors in every way possible, from primary prevention to shelter to advocacy, to all those different spaces. And her coming, being a DV person, but being like, this brain injury piece is just something that has never really just been a part of my universe at all. So, and I guess the next question, and maybe for the rest of these, and we would love if anybody has any comments or questions, please feel free to raise your hand or put them in the chat box or take them off. We really just want to kind of have a conversation with you all and share about how some of this just really interesting, really collaborative, that work that continues to kind of evolve and change, kind of how this has come to be. So like I said, if you have any questions, comments, or thoughts, please put them in the chat box or take yourself off mute or whatever works for you. But the next question that I'm going to ask, and like I said, I put together just like a series of questions, and not everybody, needs to answer everything. But I guess the next question, I know you talked about this a little bit, Julienne, but just kind of like, what got you interested in learning about this intersection from your perspective of the violence and brain injury piece? And I don't know if somebody just wants to, like I said,
I can speak to that.
Yeah.
Hi, my name is Annika Grayson, and I'm a survivor of what's being discussed in terms of the serial stalking strangulation component in domestic violence. I am currently displaced for the past 9 years, trying to escape it, and reporting it has been absolutely paralyzing. It's non-existent. It doesn't happen. I've had a spinal injury from strangulation. It's a very consistent, regular component as a survivor of sex trafficking. So I have distance from that element right now. It's very hard to find services. I was on my way to be closer to pink concussions and be more a part of the collaboration as it grows. But again, I got segued, and I'm in the midst of trying to navigate my current circumstances still. So along with the brain injury, which also occurred due to the domestic and interpersonal violence and sex trafficking, I'm very grateful for all of the service providers who are just trying to find and understand the DV component as it exists when we are displaced, and choosing not to remain in a home that I own with my service animals. And then again, being more and further displaced and more and further distance from support. So I join you from that dynamic, but at the same time, I also have executive skills, and how can someone at this age have been surviving this for the whole of my life as an executive secretary? So the perception could be that, oh, I'm choosing that environment or I'm choosing those people. No, oftentimes we're chosen and we don't know it. And the part of the component in this strangulation that I think is missed is that oftentimes these types of assaults begin with incapacitation through a rehypnol or some kind of NICU or some form of incapacitation. There are a lot of different dynamics that are filmed and sold. That's why it's such a massively lucrative business. And that said, I will bow out, but thank you for listening, and I'm glad to be a part of Concussion.
Thank you so much, Annika, for sharing. I think that has been among one of the key parts of this work that we've been trying to do in Ohio, is making sure that we have a space and a place for survivor voices to really, we have so much that we need to learn from you, Annika, and other survivors, and what that experience has looked like, and what has been helpful and what has not been helpful, and where some of those services are working well and where they're not working well, and where the gaps are, and all of those different pieces. So I think that has been critical, and we are so glad to have you here and so glad to have your expertise. And I hope that that we are all here to kind of support and do whatever we can do to help you get where you need to be. So thank you for your leadership in this area. And I see
Can I jump in, Rachel, and just respond to Annika just for a second, just since she's speaking from a survivor point of view. I want to be really clear that we are very not in the know as advocates about brain injury from violence. And I have my doctorate, so right, I'm a little probably farther than a lot of people in regards to education, but not just education in the university world, but education about brain injury from violence in general. And I advocate so much differently now, knowing more about how brain injury impacts survivors. I had a survivor today who I've been working with for about a year, and she was the one that really, I would say, like, I was in tune to the fact that I could tell she had suffered a brain injury from the strangulation the day before. And even working with her today, she's still struggling. And I could say things like, oh, that's so weird that she'll never remember my name. Like, how aloof do you have to be? Like, how many times have I texted her and she doesn't even remember my name? She honestly just can't remember names anymore. She can remember positions. She can puts my name in her phone as advocate, but she doesn't remember names anymore. She puts dentist in her phone now. She puts doctor in her phone now. She puts obviously like mom or friend in her phone now because names do not come to her anymore. And as an advocate, I could blame her for that or think about like how aloof she is that she can't remember that. But having education now, I treat her so much differently. I empathize with her so much differently. I provide services to her so much differently. And that's just me because I'm aware of this. How many thousands of service providers are just unaware that our survivors are dealing with this? And that's why I'm so passionate about it, because she literally said today, like, Julienne, I would not be here without you. I would not have pursued this without you. And I don't usually toot my horn, but I can tell you that had I not known this, I wouldn't have done as good of a job. And I wouldn't
I
have
just want to interject and I'm sure that the ACEs scoring system is becoming more and more used in terms of social services and healthcare. For me personally, when I did an ACEs score in terms of strangulation, which my first drowning and revival through these sex traffickers was at the age of 5. So by the time I was 8, I had maxed out the ACEs score at 18, assault. Just through strangulation. So there, my neurologist, who's also aware of my circumstances, and thank goodness I continue to heal. I just wanted to bring that to the table. If you're not informed on the ACEs score, try it when you are doing it. Try to conduct it from a perspective of strangulation, suffocations, and drownings, because those are very real components, and a lot of shame, or because there is the non-believable component of having gone through that. No one could imagine.
And we're also trying to do this for the ACEs information for probationers too. We're trying to do a brain injury screening and an ACE score for probationers, understanding that they too could have encountered brain injury through their lifetime, through trauma or other things as well. So just know that in the justice system, we're looking at it from both sides.
There anyone else? I don't know if either any of our participants here or Kedar or Kasey or Kim kind of want to share about, coming at this intersection. And many of us have been doing this work for a long time in our respective spaces. But, and I don't know, Kedar, I hope I don't mind be putting you on the spot, but like,
No, you're
our
good.
brain injury guy,
Well, I mean, so I think that's kind of the perspective that I have is I'm stereotypical and fairly representative of the brain injury side of things, right? How did we not know? How did we not figure this thing out? It's so obvious. And so you kind of have to eat that, right? There were many other things that we probably focused on or something along those lines. But, for me, early on in my role in brain injury, which hasn't been a long career, it's something that's newer in my career, but, I got to meet Rachel. And we got to have conversations between Rachel and her research partner here at OSU, Julienne and Hiremath. And, we were able to start to put that into our center and start to think about projects in this space, at least think about that understanding of who are we missing in our studies? Who are we missing in terms of a perspective? And equally, who are we missing when we think about how to train our clinicians, our frontline workers, our researchers themselves? And so, for me, Rachel, I think the question that you had prompted us at the beginning was, what got you interested? I mean, how could you not be? This is completely undiscovered country. Just from an academic perspective, there's so much richness to, uncover. But at the same time, there's so much good work that you can do with low-hanging fruit and simple projects. And so I think in those ways, it's woken us up and also mobilized us very quickly to be able to think about, okay, now we know. So now what?
Right. Thank you. Kim, do you have anything you want to add about this kind of this intersection?
Yeah, I think for my perspective, I've been in children and family services for about 35 years. And the discipline would say, well, parents don't parent very good because they didn't learn how to parent. There's some truth to that, right? The research would say. But then I think about how many kids come into the child welfare system, into child protective services because of something that has happened in that home, something traumatic. And to be able to make that connection as to, yeah, that parent may not have learned how to parent because of the environment that we're brought in, but what about those parents who, or that parent who, yeah, did the best that they very could, and then kids go back home, they're reunited, or they come out of foster care or a group home and they go back in, and still that mom or that dad still isn't able to because we haven't looked at, well, maybe they just can't. Maybe they just can't. And I appreciate, Anika, the examples that you gave us. I mean, that's just like profound for me. The, as I mentioned, the struggle becomes in the world of child welfare and child protective services, it's huge. There's so many things that people have to pay attention to. So my passion in working with this team is about how do we take that message? What's the tagline for why child welfare workers need to pay attention to this issue? I think we would be surprised. Like I mentioned, we don't really collect data, and the data that we collect in terms of just the presence of DV or intimate partner violence in the home is only anecdotal, and it's only as accurate as the caseworker fills out in the record. So it's been a fascinating journey thus far, and starting to get quite a few people in child welfare, policymakers, to try and think, well, how do we collect the information for this? So my passion is really, really committed to this because we got kids that got to go home.
And I think something that we have learned kind of from the domestic violence space, as I said, being in domestic violence I had been at the statewide coalition for almost a decade, and had spent many, many years leading a project around trauma-informed approaches without ever mentioning brain injury, without knowing what a concussion is. If you had asked me in 2016, what do concussions have to do with your work? I'd have been like, that's something that happens at football. I've never thought of it. In case you can't tell, like, I like what I do a whole lot, and I'm very, very interested in what I do. And I also don't have, for many of you direct service providers who might be on here, I'm not trying to run a shelter at the same time. Like, I get to think about this stuff. And then it was one of those, like, from the very first week of working in a shelter in 2004, I had people telling me about head trauma, like, and seeing signs of head trauma, but never really putting two and two together. So I always say, when I do some of this training, it's like, it's kind of like, it's something that you can't turn off. It's like, once you see it, I always say, like, if you've ever been like shopping for a new car, I don't know if anybody, my daughter just rented somebody, we have a new car now, but you know how, like, you're shopping for a new car and then you see it everywhere and you're like, I didn't know so many people drove Toyota Corollas, but I think that this is something that's very, very hard to unsee. And then I think it's not only do the service providers, what Julienne was talking about, service providers and those perspectives, but I think it's even survivors themselves. And that's something that we have learned we work with so many survivors who have so much self-blame, so much shame, are having problems doing things, and really are telling themselves and other people are telling them, well, you just need to care more. You just need to work harder. You just need to do better. And when we don't have, I think that was a really, really illustrating example of you talking about, Julienne and your survivor who's like, she's not stupid because she can't understand people's names, and she can't remember people's name, having an understanding and having a context has really changed not only survivors and how they feel about themselves and how they understand themselves, but also how service providers see and manage things that are difficult when people are struggling. I know, Catherine, I wanted to see if, I know you had said, could you add just a little bit about kind of your experience as you were setting off at this whole, like, we have brain injury, we have women, and kind of how the DV piece has played out there and what that has looked like for you.
Well, in 2012, I had not met Angela yet and didn't know about Angela's meeting in 2010 earlier to us starting Pink Concussions. But the tagline was concussions in women in sports, domestic violence, military service. And when I was putting together the 2015 event, I got a lot of pushback. Like, you can't do those three things together. You got to pick a lane. And I'm like, why? It's all the same organ, right? Like, it's the brain. Why do we have to? They're like, well, it doesn't work that way. People will be interested in the sports, do the sports. But the domestic violence was really important to me. But the funding comes down from the military to military, from the sports to the sports, and at that time I didn't know people in the domestic violence field, but the researchers are creating research that will be funded by those organizations. So I think that's why those silos existed. And I got real pushback that I had to drop the DV thing or people weren't going to come to my event. So instead, I was very rebellious and I layered it like a lasagna where it was sports, domestic violence, military, sports, and I've always done that at events. So it can't, you can't come to one of our events without getting DV, even if you're trying not to. And I don't know if Angela, were you getting pushback in 2010 about including domestic violence, or was that not happening in Canada?
Right. Well, first of all, we had a workshop. She always says I led the first meeting. I led the first international workshop, and Catherine led a real major summit on concussions and brain and in women. We had a lot on violence, actually. It was one of the priority areas, and we had representation from all different sectors. So that actually did, and it was published. And still, we have to work towards making it a priority. And the meeting wasn't just Canadian, it was in Montreal, but it was attended internationally.
Well, I always say Catherine told me when I met Catherine, which was again several years ago, we've been doing this work a long time, she'd say like she'd do sports in the military, like do sports, lock the doors, put in the DVPs, and then do the military stuff and then unlock. I'm just like, okay, we're going to get you in here and then we're going to throw in this other piece. And I do think one of the things that has been interesting, even with some of the training we've done and working with different organizations and thinking about some of this overlaps between, the brain injury space and the domestic violence space, which, like I said, I didn't know anybody who did brain injury work until 2017. I didn't know that I'm in Columbus, Ohio, the home of the Ohio State University for your brain injury people, as well as the home of the OSU TBID, which is one of the kind of the gold standard of research brain injury. Like, I didn't know what any of that stuff was. I didn't even know that there was all of this support in my backyard. But I think that has also been one of our kind of opportunities of how are we bringing together all of these people, where Kim brings a very different perspective than Kedar does, than Julienne does, and we have healthcare people and we have funders and, kind of thinking about some of the work. I always say that the other thing that's interesting about this intersection too is I think that there's a piece that we have this very, those of us who are in direct services have this very I probably, if I have any more clients I'm seeing today, I could very well be going back right after this meeting is done and talking to somebody impacted by brain injury that is happening like today, right now, and yesterday and this morning, as Julienne was talking about. But then we also have this big systems work, right? Where we're starting to think about, as Kim is talking about, like data collection and what kind of questions are we asking? And that's like very, very slow, very, very long work. And, people are interested in different ways about these different things. So I think that has been another just kind of real interesting wrinkle. But a lot of times the people who do that systems change policy work aren't really talking to the people who do the work when you're working directly with people and, kind of what that is. So that has been another just really, I think, really interesting kind of evolution of this work here in Ohio. All right, so my next question I'm going to ask to some of my colleagues from Ohio or to anyone else is just like, I know, Julienne, you've talked about this a little bit, but how does brain injury from violence, and you've talked about this a little bit too, Kim, so if this feels repetitive, that's fine. But if anybody has any other thoughts about like, how does this show up in your day-to-day work? For those of us who do direct service, or for maybe those of us who do research, or what is it that looks like? How does that kind of show up? How does brain injury from violence show up in your work?
Do you mind if I answer?
Oh.
Rachel?
Alex.
Hi,
Alex
it's
is another one of our Ohio friends. Alex,
so good to see you.
can you introduce yourself too, Alex?
Yeah, so I'm Alex Sluth. I am the supervisor of the domestic violence unit at Cuyahoga County Witness Victim Service Center. So actually, Rachel, you'll be happy 4 of my staff are on this right now because, yeah, we're really in Cuyahoga County. For you guys who don't know, it's Cleveland, Ohio. That is our really big effort this year is TBI and recognizing it as a unit and also kind of spreading that information. And what's interesting, Rachel's, after, you've kind of brought it to my attention with TBI, I ended up going through the past 3 months of police reports. So my position at Witness Victim, we have 2 advocates. We're not system-based or community-based. So we are kind of our own little island. And so we have advocates who are at the domestic violence unit, so where the detectives are. And then we work with them regardless if they want to be involved in the court process or not. And then I also have court advocates. So I've been pulling police reports from the domestic violence unit, and I found in at least a month, 4 or 5 police reports where there very well could have been a serious TBI. And bringing that to the detective's attention, I had met with them last week and kind of did just like a quick TBI talk and pulled up these little parts of these police reports. One of them that really sticks out to me was that she was pushed up against the wall multiple times, hit her head. She was speaking gibberishly and incoherent and appeared to be under the influence. And kind of what I explained to the detectives is she very well could have been, right? Like, I'm not saying, but are we asking those follow-up questions to figure out, was it that, or was it because she was repeatedly hit in the head and she was kicked in the head that day? So kind of trying to, even me in the domestic violence world, like, it's not something that was on the forefront of my mind, but trying to have the detectives and also the advocates ask these follow-up questions that are open-ended, right? Because it can be hard if you have very specific questions, but also how are we accommodating them as advocates? Are we emailing them a little synopsis of what we talked about so they have that? Are we emailing them court dates instead of, trying to expect them to remember this, or even just asking them, you went to the hospital and they said you had a concussion. I know that this can affect you X, Y, and Z. Is there anything that I could do as your advocate to help you remember, or do you need more frequent reminders? So I'd say now that it's in the forefront of our mind, I think we're seeing it every day and trying to bring that awareness to the detectives where, I would say probably every other police report that I look at very well, that survivor could have been impacted by TBI just from that single snapshot of that one incident. So that's all I gotta say.
Thank you so much for sharing, Alex. And I do think that, some of the work that we've done with Julienne and looking at the police reports, I mean, some of these police reports, even for somebody who has done this work for a long time, I mean, they're hard. They can be very hard to stomach, can't they? Julienne has been at the prosecutor's office for like, I don't know how long. And it's like reading them out loud and thinking about this, you're just like, oh, wow, where, the violence is so much, it's so different. And then, kind of what that gets interpreted as when people are showing up, where if we had had something similar that had happened in one of these other spaces, as, Catherine was talking about on display, if somebody had been tackled really badly and was exhibiting all of these things, we would have been like, oh, that was obviously a concussion, or if there had been some kind of military incident. But just even if that is what the police are directly responding to, which is probably the closest thing that we have in brain injury to like immediate first responder, I think that is pretty significant. So it's something that we're continuing to think about and look on and kind of try to understand, as maybe this is something that I think we're moving toward, that a part of the, core understanding of domestic violence, particularly police response. And I would say police response, domestic violence programs in shelters have shown very, very high prevalence of histories of often pretty extensive head trauma, that when you're working in a service, I always say, like, if domestic violence is in your name or your mission or like a part of what you do, we also know that very few people who are the first time that they're assaulted or every time they're assaulted, they reach out to the police. So as Alex said, if it's that's that one snapshot, but who knows however many other things happened before then, however many other things didn't kind of reach to the level of the police reaching out. So yeah, that's been pretty stark for us. Anybody else want to share? Go ahead, Julienne.
And it sounds like Alex is trying to kindly move the needle for the officer to say, like, can we ask some different questions? And a couple of trainings ago, when Rachel and I were training a handful of 30 or 40 police officers on brain injury from violence, we got the raised hand and he's like, lady, I'm no social worker. I don't know why you believe that this is something I should be talking about. And that was like hard because we had like an hour and a half more of a presentation to go. And we needed to get this guy along with 30 or other officers on board with the fact that if we can recognize, not diagnose, if we can recognize brain injury, you're going to get farther in your investigation quicker, because it's like a 3-hour response time when an officer goes on. They're going to be there for several hours. And they've got to get through certain things before they can leave that scene. And if you aren't recognizing brain injury, it's going to be harder on everybody. So that officer specifically, when he went back onto the street and became what we call a stop officer, officers who respond on strangulation, specifically called his lieutenant after his first run and said, that training was the most effective training I had out of the 40-hour training. Because had I not known or identified the fact that this is actually true, it's a lot different when you go on scene and say like, oh gosh, maybe I do need to take my time, ask questions differently, ask the open-ended questions, give them a little bit of a break rather than rapid fire who, what, when, where, why. And that was validating for me. It was a little bit of a gulp moment for me to say, like, I've got to dig in. I've got to get this officer on board to say, like, sir, you're going to be going on these runs. And I need you to get on board with us to know that this is actually a thing. Research shows it. Our police reports are showing it. So I really appreciate Alex taking on that initiative for her office, but just know that, that's one initiative. Now we've got to get to the police and we've got to get to the medics. Obviously, hospitals are a little more on board, but then after that, we've got to get to the prosecutors and the judges and the defense counsel. So it's like this and this and this and this, and we've just barely scratched the surface.
It's been an interesting conversation here about serious harm and where that falls in the Ohio Revised Code for felony, in order to make something a felony if somebody does have a concussion. And there's been a lot of pushback, from the county and grand jury. So, that's another big initiative here because, right, it is serious harm by the Ohio Revised Code. So yeah, it's been quite the fight over here. But all we can do is keep trekking.
All you can do is keep on swimming. Molly, I know you have your hand raised.
Yeah, I was just hoping to possibly come in and maybe share some experiences in the practicalities of supporting survivors. So I'm in Vancouver in Canada. I work in the downtown east side in a women's shelter. So the women that I support, it's very rare that I see someone who has not suffered some kind of brain injury. But the demographic we also support here are women who predominantly are daily polysubstance users, do not have housing, and are struggling to meet their basic needs prior to any kind of brain injury, right? So, I experience a huge amount of barriers. And I just kind of wanted to break down maybe an example of what that can look like. So for a woman who comes in, if I manage to get her in a taxi, get her to the hospital, what happens before we've even spoken to a triage nurse some of the time is that, a hospital, big open waiting room, anyone can walk in. I've had cases where the abuser just walks straight on in after us. walks straight up to her and then walks out with her. And because she is so terrified of the repercussions, she knows that, and the dynamics, of course, of control, right? She knows that it's going to be better for her, safer for her in her safety assessment in that moment to go with him. So she doesn't even make it through the front door of the hospital. In other cases where we have made it up to the triage nurse, what often happens is, they're very dismissive. I've had triage nurses literally turn their back on me and ignore me and ask me to leave when I've tried to bring up the fact that the woman is showing serious signs of brain injury. Then even if we get through the barriers of a triage nurse, we go to sit in a waiting room. And unfortunately, which I know probably a lot of us are in, overwhelmed, understaffed organizations, the waiting time in the waiting room can be 10 hours, 12 hours. I have a very high caseload. I can't sit with a woman that whole time. So then what happens then most of the time is the woman gets disorientated, she gets confused, she gets scared, she starts feeling sick. She either has to leave the waiting room, or by the time she does get to see a doctor, she's forgotten why she's there. She's forgotten her symptoms. Or even if she does see a doctor, what happens is they don't provide her the appropriate assessment she needs. It's written off as being substance abuse. She's not believed. She doesn't get the appropriate care. And then we're back to square one. So even getting through those initial assessment pieces, there are so many barriers. And that's where I'm feeling stuck in my role, to be honest. And in my spot in this is, I can do this training, I can get this knowledge, and I'm so appreciative of that. But there are so many barriers to even get to those starting points. And I don't even have time to go into like the referrals and the neurologist, like that just doesn't exist, right? So those are some of the barriers that, I'm really encountering and struggling with supporting women through. So I just wanted to share that.
Thank you, Molly, and thank you so much for your work. I say this DB work was a very, very complicated and difficult before the brain injury piece came on it. And, I think that this is it's at a whole nother level, but I think it does feel like, we have had some places, very, very few pockets of places who, we've worked with who have been like, oh, we're just going to get people, fast-tracked access to this doctor. And then they set aside this appointment that's super hard to get, and then survivors don't show up, and then that ends up, you know what I mean? I think that that's something that's very complex and complicated. I know Alyssa has her hand raised.
Hello. So I know that it says my name is Alicia, but my name is actually Zoe.
Okay.
I'm on my coworker's computer. So I work for the Women's Center in Columbia and Montour counties in Pennsylvania. And so we see, we definitely have the same concerns that have been shared already, but we're also seeing participants with substance use situations that are overdosing and having brain injuries from the lack of oxygen. So our Department of Health and we have the Pennsylvania Coalition Against Domestic Violence. We got a grant through the Department of Health to work specifically with brain injury and connecting EMS and police. So right now we are working on a conference that's going to be in June. It'll be June 20th, but we're going to talk about brain injury. We're going to have someone from our hospital come talk about it. And then we're going to do, our spiel on brain injury, and we're going to try and get a survivor there as well. And, throughout this time, it's very interesting to see how many people still truly don't know that there's a connection at all. So also another layer that we're trying to add is that we are starting a brain injury subgroup with our domestic violence task force. So, everything together, we're just trying to really get the word out. We do work pretty closely with our police force, and we're starting a lethality assessment program with them where they will be able to make referrals to our programs. So with that, we're trying to get them to understand that brain injury is happening with this and that they can be referred medically as well.
Thank you, Zoe. And that was totally legit that I didn't know your name was Zoe because I didn't say that at all. So thank you for sharing. And Zoe, I told you, I sent you I would love to talk with you more because I think that that's something that we're learning as this brain injury work continues to expand and thinking about violence, but it really is these under-recognized causes of brain injury, which also include the substance use and the overdose. And a lot of times that is really connected with the violence piece and how that all plays together. So that is something that we're really working to try to better integrate here in Ohio. So I'd love to talk with you all more about that. So I sent you my email, so please send me an email. I did want to, Justice, I know we only have, thank you everybody who shared. I know we only have about 10 minutes left. So I just wanted to spend just a few minutes kind of as we wrap up talking a little bit about kind of how Ohio has put together our group, our alliance called the Brain Injury from Violence Care Alliance. And I wanted to see if maybe Kedar, would you be willing, just from your perspective, to talk about Kedar played a really essential role in kind of what funded some of the work that eventually came the Brain Injury from Violence Care Alliance. So I would wonder if you would be willing to share from your perspective, Kedar, just like how did this group came to be and how would you describe what it is we're doing? And then we can have anybody else join in.
Yeah, I think I'll ask our colleagues to correct me here. So the way that my center works is that we fund these, new projects, things that aren't, the tried and true, typically federally funded research grants. And, as I said, I came across Rachel and Juliana's work around, I want to say 2018. And, we started talking and we started to cultivate a one-off project, that was going to be funded by my group as a sort of an internal pilot project, assessing like federally qualified health centers' readiness to screen and to consider this issue. And then we had another grant type at the university that was intended to bring different kinds of people together, called an action potential grant. And I think, this was the first one that we funded to essentially start to think of, well, so what does something bigger look like? Something that can spur on research, but also get different kinds of people connected. And, so we went through that process for about a year and a half, getting, conversations started. We had a couple different, what we'll call world cafes. It was a model that I've come to really love, where we get a lot of different kinds of people in and start to crowdsource ideas and strategies. And a lot of people came. I mean, a ton of people came. It was really, really lovely to see such enthusiasm. And equally from our side, we had, folks that were in like animal modeling for brain injury. We had people who were doing systems and service level work. We had people doing assessment, technologies, things along those lines. And so lots of different kinds of people came to the table from the research space, but equally so from the community. And so, those conversations were very eye-opening. And I got to say, I think it's probably that we ran out of funding for that action potential grant. And we started to think about, well, what's the next step? And so we started to put together, a bigger list of folks, especially in the justice space, because I think that was missing a little early on, and it started to come more and more and more. We got more governmental partners as well. And I don't know, I feel like I just like flashed forward and here we are with, 50 some organizations and agencies represented. We've been essentially teaching ourselves across these different types of sectors. What is brain injury? What is domestic violence? What does this intersection look like? How does the justice system work? Where are the gaps? What are those, Molly, your example was kind of one of those things like, well, okay, we can think of the solutions are there, but then they're not working, right, in practice. And so what does that look like? And now what I'm excited to see is that the organization started to turn from internal facing awareness building and education to starting to look at now being able to influence outside of it, as well as to spool up new research projects that, I think Catherine kind of said it best. They're the right thing to do, not necessarily where the funders typically would have, had grants out there for you to go and apply for. So this is, I think the state of where we are now is being able to do the individual and partnership work across professionals and include survivor voices in that, as well as then start to think about systems change. And so, I don't know, does that close.
So I just would like to add to that. I think, and I hope my colleagues from Ohio would share the same sentiment. Well, we really do have a rich history of collaboration here in Ohio. What becomes one issue for one system, I think we've learned over a very long time that it is often not just one system's issue, right? Many, and I'm just listening to some of the conversation, my head's already spinning about thinking about the extraordinary process that a mom would have to go to when a child protective service worker shows up. And that child protective service worker has 10 minutes. And I'm saying that just tongue in cheek, but they have huge caseloads, right? And so, how do we create that environment or that opportunity to say, hey, we need to figure out how we can at least ask the question that could get us to some more information. So, just sitting in on this today has been fascinating, making my head spin even more.
Julian, do you have anything just kind of like what has the Care Alliance just kind of meant for you or kind of been for you? I did put just a link to our very kind of basic, not in a bad way, but our website in the box. We do have quarterly meetings where we have a couple of meetings in person and a couple of meetings virtually. We actually have an upcoming virtual meeting. Catherine, I could send you a link to a whole bunch of virtual trainings that we have. I was going to try to put them all in the chat box, but they're all links to separate things and that can get confusing. But Julian, would you be willing just to share like what, like, and I think it's also been the networking and it's been places for people to come back, learn more information, go back into their spaces and like think about how that looks like in their spaces. So wanted to see if you had any thoughts about the Care Alliance and the value it's brought to you.
Well, I'm speaking to the choir, but as I'm sitting here over the last hour, I just keep thinking about I could talk about this all day, every day, because it's so important and it's impacting the people that we care about and are trying to provide services to. So the Care Alliance has meant education to me. I want to do more we're the largest municipal court in Ohio in regards to volume. I have 22 advocates on our staff. So we're like cockroaches, we're everywhere. We're the puppet masters of a lot of things. So I'd like to get more education out there. And we're trying to do that through some focus groups right now. It's just a slow process. I'm a little impatient, but we're trying. And then just the relationships that we've built, to be like, oh, now I know somebody at that agency. I can just text them or I can call them or email them and I know they'll be responsive to me. So I feel like we're just brushing the top of something very large and huge. And I get excited about it every time we talk about it, just because we're going to provide such a better service today, down the road, tomorrow, months from now, years from now, to survivors of brain injury from violence. And I just really look forward to continuing that conversation with everybody.
Thank you all so much. And thank you, Alex. And thank you to everybody else who has joined us today. As you said, we could continue talking, but I'm assuming people have other things to do this afternoon, even though you'd rather stay on here and keep talking with us. But I'm just going to turn it back over to Catherine as we close out.
Well, thank you, Rachel, and thank you for all the guest speakers, and really love to have you all, the links in there to join up the task force. We don't meet in the summer, but we meet from September, usually till June. And the recordings of past since 2018, we have recordings on our YouTube channel and on our Pink Concussion site, and links to Rachel's stuff and Angela's. So love to have you. And yeah, hope we get to be together. Last time we were together was in Ireland for the World Congress, and I hope we are together in Montreal. And within the context, if you're in the United States, keep fighting the good fight. It's a very hard container to be helping people in right now. So thank you, Rachel. Thank you, everybody. And see you in Montreal. And if not, we'll be here in April online.
And Catherine, am I correct that a part of the April meeting will be catching people up about the Montreal in-person meeting? Yep. So if you have a little bit of FOMO, I know a webinar at 2 p.m. on a Tuesday isn't the same as a trip to Montreal, but you'll have the opportunity to join and hear all about that. So thank you all for joining, and thanks for coming. Everybody who's going to Canada, safe travels. Everybody who's in somewhere really cold, I hope it's warm soon. So everybody have a great rest of the day.
Thank you, everybody, for spending your time with us. Thank you, Rachel, for organizing this. Take care, everyone. Bye-bye.
Thanks so much.
Thank you for having us.